Okay, so I want to talk about some things that some nurses don't take into consideration when first starting off simply because you don't know what you don't know. I talked a little bit in the last video about, excuse me if you hear some noise, my 1 year old's in there playing. Put that down, book. So, I don't draw, I do certain areas on certain days of the week. I try to see all my patients that live in the same area on the same day. Sometimes it doesn't always work like that, but the majority of the time I can get it to work out that way. Um, Another way that I utilize my time and make the most of it, um, I do group homes. I do senior apartment complexes, and I have several like husband and wife couples. So, for example, if I go to a group home, um, okay, so the way home health works with intermittent visits, home health companies get referrals. And more often than not, they have a referral source, such as a doctor's office, a certain hospital who they've built a relationship with that they get all their referrals from. So if you have a husband and wife and they both need home health, more often than not, their doctor will recommend this home health company. So it's not uncommon to go to a group home or to a nursing home or a senior citizen complex who has more than one resident living there that needs home health. And the company that's in there sees all the patients. So I've gone to a senior complex who had 6 patients in there. And that's gravy because all I have to do is go to that one place that day. And usually when that happens, I don't. Like, I could just go to there, but I make the most of my time because I don't have to drive. So that means I'm seeing this patient, and then I leave. I walk out of their door and go to the next door, knock, 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 see that patient. You can see 6 patients in a short amount of time. So I would utilize the rest of my day to go see some more patients that still live in the area, but aren't that far. So that is how some days I can do 10 visits. And so people think 10 visits, 10 hours. No, it didn't take me 10 hours because I didn't have an hour driving time. I didn't have to drive anywhere. I went right next door or I went right around the corner. So keep that in mind. 1 second. I've got to go get this little girl. She got into my hair stuff. Okay. One more thing I would like you guys to make note of. So, when you have patients, I want to say 80% of my patients are Medicare patients. There's also private duty patients, VA patients, and private insurance patients. So, Medicare has strict guidelines, regulations, things you have to abide by, such as a visit has to be at least 45 minutes long. You don't have those stipulations with private pay patients that I also do see. So I can go, someone who's paying out of pocket because they just want the family just wants someone to stop by periodically and check their blood sugar, or maybe they've got a little wound on their foot um, that takes 5 minutes to take care of. Because once you've been doing this for a while, you really will become efficient. You'll know how to multitask and get things done real fast. So I can be in and out of, and let me rewind for a second. Private pay usually pays more than what you will for Medicare patients. The reason being why I said you can make anywhere between $35 a visit. The company will pay you more if they're making more. So for a private pay person who only wants you to check their blood sugar, I can do that in 15 minutes. Okay? And if you have more than one private pay person, like bam, 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 bam. I had 3 people in the same area, all private pay, live 5 minutes around the block. I saw all 3 of them in an hour and a half. So I made 45 times 3, you know? So keep that in mind. If you're going to do home health, you do have to know how to hustle. And you can make a decent living.